Good evening. I'm Terry Scoggin, the CEO of Titus Regional Medical Center in Mount Pleasant, Texas, and it's my privilege tonight to moderate and be a part of our Heart and Vascular Virtual Community Town Hall. It's an exciting night for Titus. You're going to have the opportunity tonight to meet three great physicians, and they are the foundation of our cardiovascular service line and program, not only here in Titus, but in Northeast Texas. And we're going to talk about some of the things they're doing, the impacts of COVID tonight, and really give you an opportunity to meet three great guys and see what they're doing in this community and hear about the lives that they have saved and they continue to save on a daily basis. So tonight I have the pleasure to introduce our three doctors, and I'll go ahead and get started. On the left, Dr. Aamer Abbas, interventional cardiologist who joined the Heart and Vascular Institute at Titus in 2016. He has completed his fellowship in cardiovascular research at UT Southwestern in Dallas, a clinical cardiovascular fellowship at UT Houston Health Science Center, and an interventional cardiologist fellowship at Vanderbilt University. Dr. Abbas, welcome.
Thank you.
In the middle,
thank you, Terry.
Dr. Milan Sekulic, Director of Cardiology at the Heart and Vascular Institute at Titus. Moved here to Titus in Mount Pleasant in 2005 and was instrumental in establishing the permanent cardiovascular presence at Titus Regional Medical Center. His interest in the area of cardiovascular imaging and early detection, as well as prevention of disease. He holds active board certifications in cardiovascular disease, echocardiography, and nuclear cardiology, and he's a fellow of the American College of Cardiology. And then finally on the far right, Dr. Stephen Sigal. Dr. Siegel started working here right after I joined Titus in 2012, and then permanently joined the cardiovascular team in 2016, practicing general interventional cardiology, strong interest in early detection of disease, preventative care, and lifestyle management. Dr. Siegel is board certified in cardiovascular disease, nuclear cardiology, and internal medicine, medical director of the Primary Heart Attack Center at Titus, and serves on the advisory group which establishes national standards of care for coronary artery disease for the American Heart Association. Docs, welcome. And we're going to get started tonight. Kind of our forum is as people start to join us, and we're glad for people to join us tonight on Facebook, and we're going to start taking questions. We've had some questions submitted beforehand, and we're going to use those questions. And first time I've worn my glasses. This is the first time we've done three physicians in our town hall. So we're excited. It's a monumental thing that we'll remember forever here at Titus. So we're breaking records every week. So please, on the chat lines, put in your questions, and we'll try and get to those throughout the night. We're going to go probably close to about 6:25 in range and 6:30, and then close it up right after 6:25. But I want to give an opportunity for the docs just to talk about, Dr. Abbas, if you'll start us and just talk for a minute about this last year, cardiovascular and COVID and the community. Just give us your thoughts of the last 12 months.
Thank you, Terry, and thank you for the administration, TRMC, the board member itself for providing an opportunity to communicate on this forum. And, sort of I would say from COVID perspective, a depressing year with, what exactly happened in this town in particular and in general, overall. But I come out and say that I feel very strongly that despite being a rural community, a small hospital, with comparing the overall burden of COVID, of what COVID has done, I think our hospital, our community has done fairly well, relatively speaking. I think the administration, the physicians, the staff, the ancillary staff, they all came together from inpatient management standpoint. Some of the steps that have been taken to pretty much discuss every COVID patient among 3 to 4 physicians, chief house nursing officer, has been incredible. And I would like to really commend the administration, the hospital, of handling this in such a way, because every patient getting through the ER had just not only an input from an admitting physician standpoint or the ER physician standpoint, but behind the scenes, I want the community to know that, every patient middle of the night, 2 in the morning, 5 in the morning, was being discussed behind the scenes among 3-4 bodies, including 2-3 physicians, with a tremendous amount of input, at least 2-3 physicians taking a look at the imaging, chest x-ray, CT scans of these patients. And I think that has really helped from various aspects, from management standpoint, what extent we are going to start our medication therapy, how aggressive we'll be on each and every patient, which patient is going to get discharged, which patient is going to get admitted, how are we going to preserve our protective gears, all of that. It had a great impact on that. And I think I'm very pleased to say that despite what we saw in New York, California, bigger cities, name it, I think our community has done very well.
Thanks, Doc. Dr. Sekulic?
Well, I'm very glad to be here. Thank you so much, Terry, for inviting us to use this forum and to speak to the public. I think this particular topic has been current now for a year, more than a year. And as all of us know, COVID has affected us quite a bit in different ways. Lots of people in this community have gotten sick. Lots of folks have died nationwide. And just looking at the news daily, we can see those numbers climbing up. And it's a serious problem. And I think the way our medical community has addressed and approached the issue of COVID is really remarkable. I would echo what Dr. Abbas was saying. The way our community has come together was to me unexpected. I've been here for now 15 years, and we have had ups and downs in terms of medical care. We have not had this kind of a pandemic previously, but faced with this, small hospital in rural Texas, independent hospital, has done fantastic in order to deal with this medical problem. The way we have come together as physicians and administration is remarkable. And I think that has helped us so far tremendously in helping our population and treating our patients, in coordinating care within the system and with other medical systems in order to provide the best possible care for our patients. But also the building blocks that are put in place through this experience will stay with us long after this has been resolved. The way administration and physicians work together, the way physicians work together with each other, that has been changed significantly, and that is a tremendous benefit that has come out of all of this. So I applaud administration and other physicians, my colleagues, in really dealing with the COVID pandemic in a fantastic way. I think also it's very important for us to talk about these particular questions that people have regarding COVID virus, regarding pandemic, regarding measures that we take to deal with sick patients, measures that we take to prevent sickness, to prevent spread of disease, to prevent virulence or complications in people who are affected with virus. There has been a lot of misinformations out there, and I think it's important to get the facts out as we have them, and to share that, to be transparent, and to really share our thought process behind approaching prevention and treatment of COVID. And I'm glad that this particular forum is going to probably help clarify some points and some questions that people have regarding this disease and pandemic.
Thank you, Dr. Sekulic. We're going to a little bit of difficulties on one of our doctors who we fall off, so we're pulling back on. I want to just give an update of a couple things that Dr. Sekulic just said. On the behalf of the Board of Managers of Titus, and of myself, and of my wife, and of my mother, who all are members of this community, I want to thank these three doctors. The medical staff at Titus Regional Medical Center over the last 12 months have been nothing short of phenomenal. The work that has been done by these three cardiologists in partnership and collaboration with their peers of the medical staff, and the work that they have done has just been, it's been a blessing. And I've had the privilege of sitting at the table and sitting on Zoom calls and sitting on regular phone calls and meetings with these physicians over the last 12 months to see them in action and see them from a servant standpoint of what they've done over the last 12 months. And when this crisis came not only to Mount Pleasant, Titus Regional Medical Center, and Northeast Texas, these three physicians and our medical staff stepped up. They came to the front of the line and wanted to know from day one, how can they be a part of the solution to save lives? And I truly believe that the work that they were instrumental in and that our medical staff have saved quite a few lives in Titus County and in Northeast Texas. From a cardiology standpoint, just to give you some numbers while we get everybody back online, to give you a few numbers, cardiovascular disease, the number one cause of death in the United States. It's also the number one cause of death in Northeast Texas and in Titus County and our four surrounding counties. I refer to it as the chicken fried steak region. And a lot of the issues that we have from a demographic standpoint and social economic standpoint and some of our choices that we make from a healthcare standpoint, cardiovascular disease is the number one cause of death. From a Titus Regional perspective, it was the number one reason for transfers for our health system for many years. So in 2016, with the support of Dr. Sekulic and brought in Dr. Siegel and Dr. Abbas and our board of managers, decision was made to build a cath lab in 2016 and to invest in the cardiovascular service line. We went to 24/7, 365 cardiovascular call. And just so you know, tonight with three doctors here, all of our doctors are on call or are here right now. So at any point, any one of our doctors might have to leave this to go take care of patients. So I would encourage you, please continue your patience. And I am going to start giving questions, and we'll see if we can switch back to some of our doctors. I want to start our first one tonight. Should someone with heart issues get the vaccine? Vaccines are number one thing that we're hearing about right now, Dr. Sekulic, and we're constantly putting stuff with vaccines out there. Should someone with heart issues get the vaccine?
I think, Terry, this is a fantastic question. That question has been asked in my office numerous times. I'll start off by saying I've gotten the vaccine, both shots of Moderna. No significant issues with the vaccine. I think the resounding answer should be yes. We know a few things at this point. At the very beginning, when this started in Wuhan, China, and then spread throughout the world, we have noticed that heart is getting affected to a significantly higher degree than with other infections, with other viral infections. And data was not clear at that point. It's much clearer at this point. We know that certain cardiovascular conditions predispose you to react poorly, to get significantly sicker if you get infected with Covid. So some of those issues are high blood pressure, particularly uncontrolled hypertension, congestive heart failure, and coronary atherosclerotic disease. Particularly those conditions that are not well treated, not managed, put you at a very high risk. So number one thing you can do is not get COVID. That's a very simple thing to say, but difficult to do up until vaccine came along, because we are all social individuals. We deal with other people. And I mean, it was a tremendous change in lifestyle for all of us. I didn't know what Zoom was before this. Now I'm almost exclusively talking through Zoom with people. So I don't even know how I'm going to switch back to in person at this point. But the best thing you can do is not get infected. Vaccine is tremendously successful. The vaccines that we have are effective, tremendously effective. First came Pfizer vaccine. It was approved back at the end of last year, and then Moderna shortly thereafter. And now just about to be approved is J&J, Johnson & Johnson vaccine. Efficacy is tremendous. For first two, Pfizer and Moderna, more than 95% effective from getting any symptoms should you get infected with virus. So it is a tremendously useful. It's recommended. I recommend it to my patients. If you have concerns, please call our office or come to our office. We'll discuss with you vaccine. Um, um, and now with the release of Johnson and Johnson, the supply chain will be significantly stronger, and I hope that it's going to affect availability of vaccine in East Texas, and we're going to be able to help a lot more people.
And with that, we're continually pushing the state to get an increased allocation from the state. And with the Johnson & Johnson, Dr. Sekulic is right. Dr. Abbas, Dr. Sekulic talked about some of the things in the high risk for patients. What about, can you talk to us, what does COVID do to the heart? So what does COVID do to your heart just from a cardiovascular and disease standpoint? Dr. Abbas?
Sure. Yeah. Before I move on to this question, again, I think I would like to echo what Dr. Sekulic just said, on the issue of vaccine itself. The message is, from CDC, from thousands of people that were tested, more than 40,000 in the Pfizer trial, the Moderna trial, the American Heart Association, the message is clear that patients who have who have heart conditions should get vaccinated. In these trials with thousands of patients, almost 25% of the patients did had risk factors, comorbidities, heart conditions, and they were tested in these trials. And plus, up until now, millions of people worldwide have had vaccination done, and we haven't heard anything out of the blue that now people are going around with a 5G signal, in their bodies. So it's not that vaccine is causing any havoc out there. So as Dr. Sekulic mentioned, people with pre-existing heart conditions, if they do get COVID, they have a likelihood of having bad outcome. And I think, my family, my mom, who's 83 years old, I've gotten her vaccinated, and the message is very clear that it's better to get the vaccine than the disease itself. So that's my 2 cents on to get the vaccine or not. Now the next question, which you just asked me, how does COVID affect the heart, or what does it do to the heart? So in our experience, majority of the time, the COVID patients may not present with any particular heart symptoms when they come to the hospital or they get it at home. They typically have symptoms of a typical flu-like illness, cough, malaise, fatigue, headaches. When the disease progresses, the main concern is the effect on the lungs, and that's when they start complaining of shortness of breath. Now, so that's the most common scenario, that they don't present with any heart symptoms to begin with. However, what we have observed most commonly is that they will present, when they come to the hospital, we can pick up some abnormalities in their testing, mainly some blood tests, some of the biomarkers which indirectly or directly tell us that the heart muscles are affected or the cell injury has happened. There's a biomarker which is called troponin, which is commonly used to look for cell injury of the heart. That can be mildly elevated, or some of the biomarkers of heart failure can be mildly elevated. Those are the things that we pick up commonly as an inpatient. And again, just to a mild extent, not that they are tremendously high. Now, the small minority of patients can then come up with symptoms that are pertinent to the heart. And again, some of those symptoms overlap with the findings which these patients have because of the lung involvement, such as shortness of breath, which is also a symptom of heart failure. So heart failure is one. They can have some chest pain, again, from the pneumonia itself, or due to the lack of oxygenation in the blood vessels supplying the heart muscles. That can give them the findings of a chest pain itself. Again, some of the overlapping symptoms of COVID pneumonia versus myocardial ischemia. Ischemia meaning lack of oxygen supply to the heart muscles. Again, in rare instances, the overwhelming inflammation of the COVID virus itself can cause clot formation in the small vessels of the heart itself that can present with real heart attacks. Again, not the majority of these patients present like that, but a minority of those, can have those presentations. Very rarely case reports, there are cases where patients have reported with shock, low blood pressure, cardiac pump not working effectively. And those are the patients really at high risk. One of the relatively commoner presentation, again, the stress of coronavirus itself on the lungs and the body, the inflammation can typically, especially for those patients who have underlying heart disease, can put them into heart failure. And again, there are a variety of types of heart failure, and one of the heart failure is a type where the pressures inside the heart are elevated, and that's the type that can get affected. The strain on the lungs itself can cause right-sided heart failure for patients who have underlying lung problems, and this inflammation affects the lungs itself. Therefore, that has an indirect impact on the right side of the heart, and right-sided heart failure, leg swelling. So those are some of the presentations on these patients that we see. Minority of the patients, again, I would say in single digits, some of these patients can have certain irregular heart rhythm problems, certain premature extra beats that can present in these patients. We call them PVCs or PACs. Rarely we have picked up, again, about 5 to 7% of the patients can have a condition called atrial fibrillation, irregular heart rhythm that originates from the upper chambers of the heart, and it's a fast heart rhythm that can be there, and that's what we have observed from certain of the trials, and we have also come across in our clinical practice. So I think that's what comes to my mind at the present time, from cardiovascular presentation.
And I'm going to welcome back Dr. Siegel in just a second. And I so apologize with a computer crash right at the beginning. But Dr. Sekulic, you mentioned just a second ago, and while we just got a question in online, you talked about J&J, the newest of the 3 vaccines to the market. Is that one safe for cardiovascular disease? Have you heard the research, or what have you heard from J&J different than Pfizer or Moderna as related to cardiovascular disease?
Yeah, that's a very good question. I think there will be a lot of questions regarding J&J because it's a newcomer. The one thing that Dr. Abbas mentioned is the study population for J&J was also, I believe, in a 40,000 people or patients range, and it's a little bit different vaccine than Moderna and Pfizer that uses a virus as a vector. It's more of a established technology as opposed to mRNA, which is a new technology, relatively speaking, new technology for Moderna and Pfizer vaccines. The vaccine is very effective. There will inevitably be a comparison between J&J and Moderna and Pfizer, and the numbers that are circulating around for Moderna and Pfizer are 94.1 or 95% for Moderna and Pfizer. However, the numbers that are coming out for J&J are, I believe, 66%. And that's an average in terms of response to infection. However, I would caution against direct comparison between those numbers because the studies were done differently, designed differently. Phase 3 study for all 3 were different, particularly J&J compared to the other 2. The 66% efficacy number was protection of people against developing moderate to severe disease, and that particular study was done was a international study, was done in South Africa as well as in South America, and the numbers ranged from 50 something to 76 or 77% protection. I believe 2 weeks after the single shot. It's a single shot vaccine as opposed to double shot for Moderna and Pfizer. All the experts advise to take the first vaccine that's available to you, whether it's Moderna, Pfizer, or J&J. Yes, they're safe for heart patients. We have we have a similar amount of information for J&J as we had for Pfizer and Moderna once we started. No significant concerns in terms of side effects as far as cardiovascular system. Protection is definitely there. And if you look at protection against severe disease and death from coronavirus, the protection numbers go up to high 80 or 90% range. So really, it's a good vaccine, and I think the advantage that it has compared to Moderna and Pfizer is it's a vaccine that can be stored in a refrigerator, regular temperature in a refrigerator for up to 3 months, and it's a single shot. Now they are looking at a regimen of 2 shots, and that's being investigated right now. But with the single shot, the numbers are quite impressive. And again, what you need to look at is really comparing that kind of effectiveness against you contracting disease. That's an issue here. Particularly if you have cardiovascular conditions, you're at a high risk of developing bad outcomes, severe outcomes, complex disease, and dying from either coronavirus or associated complications. So I would definitely suggest, if you have J&J available to you, once it comes out, I would take it.
Okay. Dr. Siegel, sorry about the computer stuff. I want to go back to the first question we started back. Talk about the last, take a couple of minutes if you don't mind, and talk about the last 12 months. Sure. About from your experience and from a community, heart and vascular, but just COVID in general.
Sure. Well, I've been in a soundproof booth, so I'll try not to be repetitive. At least I hope I won't be with what's already been said. But I think that we have to look at COVID in terms of 3 major sets of problems. The first is the problems that we have with heart disease that's directly related to the actual COVID infection and the acute infection. The second being the longer term effects on the heart post-COVID infection, which we're just beginning to learn a little bit more about now. And the third is one that sometimes gets missed, and that is the fact that because of concerns of the widespread nature of the pandemic and the potential for infection by coming into the hospital that people are concerned about, that they've often have delayed care for acute illnesses, particularly for heart attacks and strokes. And if you look at national numbers, there's been a 30 to 40% decline in the number of patients who've come to the hospital for treatment of acute heart attacks and strokes. That's not because the COVID virus in any way protects people from those diseases, but simply that they're failing to come to the hospital, often because they're afraid to do so. And I think that part of our mission has to be to remind people that we take very strong precautions here at the hospital, as most hospitals do, to protect our patients from infection from other patients by isolation techniques and good sterile techniques, and that the risk of dying from a heart attack or a stroke is still much higher than the risk of dying from an inadvertent pickup of a COVID infection. And so to not come to the hospital when you're acutely ill with a disease because of concerns of potential infection with COVID can be a very deadly mistake. And that's something I think we owe to the community to remind them about.
Well, I'm going to tell you this. For somebody who's been in a soundproof booth for the last 15 minutes while we had to bring the computers back up, you nailed it. You went from some different points, and I think when you combine where all 3 of you went, it was a perfect combination. I want to ask a couple questions to you, Dr. Siegel, one that you just brought up. But before we get there, we were talking to Dr. Siegel earlier about the vaccine, and I asked Dr. Sekulic just about something we're getting. Talk about the effect on AFib, because that's been a question that I've seen several, and we have some groups who are getting the vaccine tomorrow. But how does the vaccine affect those who have AFib? Sure.
Well, we know that in the population that was tested for the Pfizer vaccine, about 2% of the patients in that population had significant heart disease, and we saw no increase in adverse cardiac effects, including atrial fibrillation, in that population. With the Moderna vaccine, about 25% of people had severe underlying diseases, including heart disease, and again, there was no signal of a significant increase in progression of heart disease or with atrial fibrillation. On the converse, we know from a large registry of studies that's been run by the American Heart Association, involves about 105 hospitals in 35 states and a little over 22,000 patients who've presented to the hospital with COVID infections, that the incidence of atrial fibrillation with COVID infection is about 8%. So clearly there's an increased risk of atrial fibrillation if you develop COVID. There's no clear indication that we have an increased risk of atrial fibrillation with taking the vaccine to prevent COVID.
So let's stay on that same topic. And you talked about in your intro about the second case, and the second one concerned about the impact. If somebody had a light case of COVID, what would you be concerned about damage to the heart? So when you think about somebody who maybe did not have a severe case of COVID, but so much of our population, especially cardiovascular community,
Sure.
What would be from a light case of COVID? So what they should be concerned about, and what do you recommend as next steps?
Right. Well, a couple of things that I would point to. One would be, there's a large study that was done at the Massachusetts General Hospital that looked at patients who had COVID infections, and they found that almost 90% of them, 87% of patients, had persistent symptoms of shortness of breath, chest discomfort, and fatigue that lasted for up to a month after their acute infection. So we know that patients are going to continue to have symptoms, and the question is that a lingering effect of the virus on their body in general, or is it a cardiac effect? Along with that, you look at two studies that have been done in Germany. One was a very interesting study. They took 100 patients who'd had COVID infections, and they did MRI scans of their hearts, and they found that 78% of those patients had evidence of viral damage to their heart, even though clinically they had not had any cardiac symptoms. So we know that there is a low level or subclinical amount of damage that can be done to the heart with an infection with COVID, even though a patient may not have those symptoms. We also have a similar study in Germany that was done. It was an autopsy study, unfortunately, of patients who died from COVID. And the overwhelming majority of those, a little over 2/3, had significant damage to their heart from COVID infection. So certainly the COVID virus can infect myocardial cells, can cause damage to the heart muscle. In most cases, fortunately, that damage is very mild. How patients will heal over time is still a question. And we believe that those with very mild amounts of damage will heal by themselves, but some people may not. And so you have to listen to your body. And if you're having persistent symptoms of shortness of breath, chest pain, generalized fatigue, that's when we have to think about doing some specific testing on your heart. We don't, in general, at this point, recognize that everyone who's had a COVID infection get their heart tested, because we don't really know that that's effective or useful, and we don't even really know what the proper test would be. But if you are having symptoms of persistent shortness of breath, persistent chest pain, persistent fatigue, then at that point, it's worth looking to see whether or not there's any evidence of significant damage to your heart muscle that might need additional treatment.
Thanks, Doc, and welcome back.
Thanks.
Dr. Sekulic, you talked about the vaccine earlier, and you're passionate about encouraging people to get the vaccine. We've talked about in some of our meetings over the last 12 months, different groups and certain groups or groups of people or certain pre-existing conditions that put someone more at risk. Will you talk a little bit about that information and some of the concerns that you have and some of the advice you would give related to pre-existing conditions and also just different demographics?
Yeah, I think that's a good question, Terry. I think the pre-existing conditions are playing a huge role in terms of response to COVID infection. And from cardiovascular point of view, big three, they're not the only ones, but big three would be coronary atherosclerotic disease, hypertension, and congestive heart failure. But we can add to that group also arrhythmias, diabetes mellitus, lots of other conditions that are fairly common or are very common in our population, particularly if they're not well treated. So I think the important point is you need to be aware of conditions that you have, and particularly if conditions are not optimized in terms of treatment, that really increases your risk of developing adverse effects should you get infected with a COVID vaccine. I would echo something that Dr. Siegel was saying in his introductory remarks. The dimension that we don't necessarily see right away, we see it later on, and that's the group of patients who have chronic conditions and who have delayed care of those chronic conditions due to COVID pandemic. And as we know, this has now lasted a year, and we don't know exactly when this is going to end. We hope this year to a significant degree, but the important point is to address your chronic medical conditions, to see your primary care physician or specialists, particularly cardiologists, since these issues are significant risk in terms of adverse outcomes. So one thing would be definitely to encourage people to seek care for maintenance purposes, management purposes, and particularly in terms of acute events such as heart attack and stroke. The other point I would make is the mention that also we don't clearly see, and that's a group of people who are very well have adapted mitigation strategies. So they're protecting themselves, they're limiting contact with other people, they're keeping distance, and now that has been going on for months. And particularly patients that we deal with, which tend to be older segment of population, what happens is they're not all this social distancing translates into less physical activity at home. So they don't get virus, they didn't get COVID, they don't show up as a statistic when we look at COVID pandemic. But what's happened is they're not physically active for months, and they are deconditioned, and they become very susceptible to different kinds of complications of their chronic conditions. So I think it's affecting our population to a significant degree, whether you have contracted COVID or you haven't gotten COVID and stayed at home. So I think some of these things we see now in practice as people start coming to the office. But what we still don't know is what the long-term effects will be of all of these changes that have taken place within the last year.
So Dr. Abbas, I'd like to go on that question that Dr. Siegel and then Dr. Sekulic got into on both of the introductory comments. But what symptoms during COVID should you watch out for to avoid heart disease? As we talk about the symptoms and how it relates to the impact of COVID on your heart, what are things you should look out for? Dr. Sekulic talked about some things you'll watch for, but what are some of your recommendations for somebody to watch for to avoid heart damage?
Well, before I come to the point of, what symptoms or what should I watch for to avoid heart damage, I think one of the other important message that needs to go out over here tonight is also, what should I be doing to avoid COVID? Because I think, the good news is that we have the vaccines, and that's great, with great effectiveness. But, we still don't know a lot of long-term what's going to happen after 6 months or a year. And it may take us, maybe a couple of years before this thing settles down and we all have herd immunity. And I think the silver lining from all of this is, the completely new dimensions that we have learned about hygiene, frequent hand washing, mask, face mask, using sanitizing agents. And, the entire population mass have come together. And when I say that, it's been almost, we are getting close to having, closing out our winter season, but I personally haven't come across a single case of flu virus itself in the hospital. So, I think that's one big lesson that we have to take it from this point onwards, while we, face this challenge of COVID itself. And then in terms of, watching out what symptoms are, what should we be looking for to avoid heart damage, I think it's mainly just the the symptoms that we have learned off from the heart disease perspective itself. If we are having chest pain that is, even if it's atypical, it needs to be looked at. It needs to be addressed. It needs to be not something that we should just sit on and say, well, you know what, I had COVID and this is probably nothing. Because as we all talked about it, COVID can affect the heart. It does, causes inflammation, and the inflammation itself can cause blood clots, and that can lead to heart attacks. So, any kind of chest pain should be, should make us wary of it, and we should look out for it. Similarly, palpitations, 5 to 7%, 5 to 8% incidence of atrial fibrillation. So anybody with irregular heartbeat, fast heartbeat, concerns, should be brought up, and they need to be evaluated. Depending on the severity of the symptoms, it may be a ER visit through 911. Heart failure, patients who have congestive heart failure, or even if they don't, COVID itself can cause shortness of breath, which primarily can be due to lungs, but then as we talked about, it can be the effect on the heart itself. So any shortness of breath, which is, more than usual from a baseline of a particular individual, should raise red flags. And it should not be that, I don't want to go to the hospital because there's a lot of COVID around it, but this needs to be taken seriously. So those are a few of the red flags that should come to the mind, and one should take it seriously. There are lots of reports out there in terms of symptoms of TIA and strokes, which need to be thought about. Any speech difficulty, any difficulty from weakness in a particular part of the body, right side or the left side, that has to be taken all seriously.
So with that answer, I want to change questions up a little bit, and because you said a couple things in there, and Dr. Sekulic and Siegel said some things. I want to ask each individually, and let each of you talk for a couple minutes. I'm going to start with Dr. Siegel. But what are you seeing in the office or in the hospital from heart complications with COVID patients? What are you seeing? The stuff that surprised you? I know. Dr. Sekulic talked earlier, Dr. Siegel, about some of the things that are happening in the hospital, and Dr. Abbas talked about the COVID huddles, and Dr. Thurman and some of the things and all the stuff we're seeing. But from your perspective, I think me as a community member and people on this town hall forum tonight, what are you seeing, and what are some of the things maybe that surprised you that you're seeing, and some of the complications that you're seeing right now with your patients?
Sure. Well, the COVID virus has many effects on the heart. Of course, as I said, it can attack the heart muscle directly and can actually attack muscle cells in the heart and cause heart damage. And that's, I believe I heard Dr. Abbas through the wall earlier mentioning that we sometimes see rise in troponin levels in patients. So that's an enzyme that's contained in heart muscle cells and is released when they're damaged. And so we sometimes see some low-level troponin elevations that we typically would think of as a patient having a heart attack, but in this case, they're not having heart damage because of a blocked up artery, they're having heart damage because of a virus. And that heart damage can then cause further weakening of the heart muscle. So if you're a congestive heart failure patient has a weak heart muscle to begin with, and you have further damage to your heart muscle from virus, then your congestive heart failure can get markedly worse. And that can be a problem. On the other hand, on the blood flow end of things, we also know that the COVID virus causes us to form blood clots more quickly. It does that by a couple of mechanisms. It has a mechanism by which it creates certain proteins that we create antibodies to, and those antibodies cause our blood to clot more easily. That can be controlled somewhat by using blood thinners on patients. So it's become very common for us with COVID patients to empirically start patients on blood thinners before they develop clots, because we know a large percentage of them are going to develop clots in their legs that may move to their lungs and be a life-threatening problem. They also are going to develop clots in their carotid arteries that can cause strokes, and they can also cause clots in the arteries to their heart that can cause heart attacks. So we certainly have a much lower threshold these days for putting people on blood thinners to try to prevent those devastating consequences. So the effect on the heart itself will also depend on what underlying heart problems you have. As I said, 8 to 10% of people may develop atrial fibrillation. That's taking patients who have not previously had atrial fibrillation. But if you've had a previous problem with irregular heartbeats and you then add the COVID virus on top of that, you'll see a much higher incidence of recurrent atrial fibrillation. So in addition to that, you have the general stress that's put on the heart by having to fight this viral infection, which is not just related to the lungs or to the heart, but to your whole body. And the increased work that your body is having to do to mount a response against this infection will also put additional stress on the heart. So people who may have borderline blockages in their arteries may suddenly develop chest pains, whereas their blockages in their arteries are not as severe as you might expect. And so we're having to treat them more aggressively to control those chest pains, even though there may not be a tight blockage, for example, that needs a stent or that needs bypass surgery, but they're going to develop more symptoms because their body is working so much harder and is under so much more stress to fight the virus. So there are direct effects on the heart, and those we know about, but there are also the indirect effects on your heart that are going to cause more severe problems with congestive heart failure, more severe problems with angina, and more severe problems with irregular heartbeats. And I guess the one surprise that I can say I've had, and it's been a good surprise, is that when we first started hearing about the cardiac effects of COVID, we were hearing horrible cases from the Northeast of people with devastating direct infections on the heart, what's called myocarditis, leading to severe congestive heart failure. And as it turns out, the incidence of that has been relatively low. Overall, national averages, it's been on the average of about 1%. But I have to say, when the virus first became public knowledge, that was a devastating concern that we all had because we felt pretty helpless in fighting it. So that's actually been a good surprise. But I also think that part of the reason our patients have done so well is that we have a really fantastic multidisciplinary team caring for them here in our hospital. And it doesn't involve just us. In fact, we're only a small part of that. It involves the intensivists, it involves the hospitalists, it involves our COVID task force, it involves the efforts of Dr. Thurman, who's taken a lot of this on himself to become one of our local experts on inpatient COVID treatment, and on Dr. DeLisi and his colleagues who've taken upon themselves to become experts at outpatient treatment of COVID disease. So in a way, they've made our job a lot easier. But it's really been the coming together of the medical staff to treat this as a team that has led to what I think have been really outstanding results here in Titus County. Much lower mortality rates than we see in many other parts of Texas, and certainly much less than they're seeing in New York or they're seeing in the larger cities in California. And I think that's a testament to the cooperative efforts of the medical staff pulling together to fight this as a team.
Well, I appreciate you sharing that. We've seen it here at the health system, and I truly appreciate you bringing that up and sharing that across our health system. I also appreciate the good news. We haven't had much good news in the last 12 months. So the fact that that good news about what we haven't seen during COVID is great news. Dr. Abbas, stay with the same question because it's fascinating to me to hear about what you're seeing with your patients in the office and in the hospital from a complication standpoint and from a COVID patient and heart disease. What are you seeing with your patients today that maybe surprises you or you find interesting?
Well, I'm going to share one more good news with you, and I think that's we have repeated this again and again during this broadcast. Fortunately, it's not the disease which affect the heart in majority of the cases. It's the complications are in single-digit numbers. So that's a good news. And certainly, as echoing to what Dr. Siegel mentioned, some of those really complicated scenarios of myocarditis or inflammation of the heart muscle, we haven't seen that. So that's fantastic news. I think one message that I want the masses to take from this is that, majority of our patients are put on certain medications for COVID treatment itself. For an example, Zithromax, an antibiotic, and then inpatient, we have certain medications that we use, such as remdesivir, some of the antiviral agents that we use. But more than usual outpatient management, I think the patients need to be aware of the fact that certain of these medications, if they're already taking certain medications such as antihistamines or whatnot, can have an effect on their EKGs. And that can provoke a certain heart rhythm problems. And therefore, I think communicating with the physicians, making sure when they are coming to the physicians during the initial follow-up or coming to the hospital, bringing an accurate medication list to the emergency room. Those are the things that I think are very important, because some of these medications can have an impact on their heart rhythm and can have a bad outcome. So that's important. From complication standpoint, I think we have already covered most of the things that we talked about, and I think overall it's good news. What I do worry about is, and what we don't know in terms of long term, what kind of effect and impact it can have on the minds of population in general. Some of the lingering effects of this bad inflammatory disease that it puts the body through, and what kind of lasting effects it can leave on our minds. That's what I worry about.
So, Dr. Sekulic, I don't mean to put you on the spot, but we've had two good news in a row. So, as we talked to you about from a complication standpoint, I'm just telling you, I really like to hear some good news from you as well.
Well, you put me in the spot right now, Terry. Well, a couple of, I was thinking, what should I point out that we haven't covered in more detail that really surprised me regarding COVID. One thing that surprised me, how transmissible it is. It is a virus that is very easily transmissible from person to person. And as a medical community, we didn't appreciate that early on. And we have learned that the hard way that's a big issue here with the COVID virus. The other thing is, which is related to that particular issue, is our mitigation strategies. I know that a lot of people are tired of wearing masks, face covering. However, this is a kind of a condition where we are all in the same game. We really affect each other quite a bit, and the sooner we get to a point where majority of population is immunized and protected, the sooner we're going to start to ease off the recommendation as far as mitigation strategies, including wearing face mask. So I would suggest for anybody listening to this broadcast to really consider that. And face masks are there for protection of other people, but for your protection as well, because there's an additive benefit in terms of person who is spreading the particles and person who is filtering the particles through the mask. So that would be a message. The other thing that really surprised me and is continuously surprising me is this: the lingering effects after people have recovered from COVID. You don't have to have a severe COVID. You don't have to be even hospitalized to have lingering effects after acute stage of infection is resolved. That is something that we are looking into, as Dr. Siegel alluded to the study in Germany where they did MRI scans of the hearts of people who have had COVID. In that particular study, majority of people wasn't even hospitalized. So not really patients who had bad outcomes, yet a lot of them had evidence of inflammation even within heart muscle afterwards. And we know that a lot of people have this so-called post-COVID syndrome or long-haul COVID syndrome, which primarily is marked by fatigue, shortness of breath, lack of physical capacity, and kind of a delayed return to physical baseline they were at before they contracted the virus. So that can go on for a few months, and we are still learning more about it. So that was a surprise to me. And I would just in closing, echo some of the comments that were made earlier. Listen to your body. When you develop symptoms, seek attention. I would not delay seeking care because there's a COVID pandemic out there. I think it really is important to address issues as they happen, address them quickly, and to maintain a relationship with your primary care provider and your cardiologist in order to accomplish your preventative care.
And Doc, I appreciate that, and I appreciate that listen to your body comment. And as you close with that, I'm going to give you another opportunity in just 1 second. But as we get closer to 6:30 and we move towards it, I just want to give, first of all, thank you. Just thank you for taking the time today and spending a few minutes talking about this, talking about cardiovascular disease in our community, but also the impact of COVID. And I look forward to sharing this on my Facebook and across this region. But as a final comment, I just wanted Dr. Abbas, since I started with you, I'll go across and go Dr. Abbas, Dr. Sekulic, Dr. Siegel, but just closing thoughts of just what would you like to say to our community as we just wrap up tonight?
Well, thank you once again, Jerry. And I think we should be optimistic that we have come through a lot, and I think now we are hopefully at the end of the spectrum in terms of dealing with this disease, with multiple companies coming out with some really effective vaccines. So I think we should go out with optimism. Again, avoid the disease itself, avoid COVID, strict hygiene measures, take the vaccine, and try to get rid of the paranoia, but maintaining the common sense.
Thanks, Doc. Dr. Sekulic?
Well, I'd like to say that we will get through this. There is light in the end of the tunnel, not as quickly as we would like it to, but we'll get through this. So take care of yourself, take care of your family, take care of your friends. If you have any questions regarding disease, regarding vaccine, regarding anything that we are facing right now, please call us, come to our office. We'll sit down and talk to you. We'll help you out. That's the reason we are here, and I'm really grateful to Terry and administration for providing us this venue so we can disseminate some facts and some information about this disease.
Thanks, Doc. Dr. Siegel?
Terry, I appreciate this opportunity to spend time with you guys tonight. The COVID pandemic has obviously been devastating to all of us. It's been devastating to our friends and families. It's been devastating to our social institutions. And of course, the loss of life can never be replaced. But we are going to get through this. We're going to work together. We're going to wear our masks. We're going to take precautions. We're going to wash our hands. We're going to try to avoid large super spreader events when we can. And we're going to have to listen to our bodies, and we're going to have to seek medical attention when something happens and not postpone it. And again, I would just remind you in the words of the American Heart Association, don't die of doubt. If you're feeling bad, if you're having symptoms, take action. Call your doctor, call 911, seek attention.
Well, I just want to say thank you. Docs, thank you for taking the time tonight. And I appreciate you guys just taking a few minutes and having this discussion tonight. And to Northeast Texas, to Mount Pleasant, to Titus County, I want you to understand we are blessed. We are truly blessed to have the medical staff that we have and the physicians that we have here at Titus Regional and Northeast Texas. And we're especially blessed to have these three cardiologists. These three guys have saved lives. They've taken care of me as a patient. They've taken care of my family. They've taken care of my friends. And I have some mentors of mine and some friends of mine that are alive today because of these three gentlemen. So thank you guys for taking the opportunity, and thank you for what you've done during COVID, but also thank you for what you've done of saving lives in Northeast Texas. Thank you for joining us tonight. Please share this. Please share this with friends. Please share this with family and get this out there. And we truly appreciate you joining tonight. God bless.